there's a quiet revolution in healthcare. It's called patient and family-centered care.
Any questions for us, Mommy?
Traditionally, doctors and nurses have been at the center of medical care.
Can I have a diagnosis?
Now they're joined by involved, engaged, and knowledgeable patients and their families. It's a new partnership. I'm Dr. Nick Macy, Director of Family-Centered Care, and this is Joe D.
Straight ahead, right? Okay.
He was born on a Monday, and the pediatrician came in on Tuesday morning and actually heard his heart murmur.
He had hemitruncutus. They had to do the heart operation, and then he's possibly going to have an angioplasty to open up his artery.
For 6-week-old Aiden, his open heart surgery turned out to be just a temporary fix. The artery that doctors opened up is closing down again, and they aren't sure why. First-time parents Tiffany and Patrick are at Joe D for an echocardiogram, then a heart catheterization to determine whether their little guy will need yet another surgery. These are nervous moments for this couple, but they do find comfort in the family-centered environment at Joe D.
All right.
Thank you so much.
Can I bring him another warm blanket? Let me, because that might be still kind of. Do you? Let me get a warm one put under.
Have you been involved from day one?
Yes.
A part of everything that's
Yes,
that's
and they've
happened?
explained everything 3 or 4 times to us and always say ask as many questions, and everybody's been very informative for us.
But what now for Aiden?
I think we should still do the cath tomorrow. The pictures that I've seen, I can show you the pictures.
As feared, Aiden's repaired artery is once again too narrow for proper blood flow.
Now, that is the left pulmonary artery going straight down. The blue going that is the right pulmonary artery. Now, you and I, they should be the same size.
Right.
Tomorrow morning's catheterization will now look at the troubled artery from inside of Aiden's heart, and Dr. Chan will see if he can fix the problem.
No, but they have a room at the clubhouse, so they can stay
you can
across
stay in the
the street.
clubhouse.
Yeah.
You can stay in the clubhouse.
That's fine. We don't have, is there a crib for him, or?
We don't have
We
a
don't-
bassinet or anything for him to sleep in is the problem.
We should be. Let me see what we can do, but I think that they can accommodate that.
Okay.
With the couple's home more than an hour away,
We got it. And the clubhouse already has a crib for you?
Okay.
You're all set.
Tiffany, Patrick, and Aiden will stay across the street from the hospital at the Conine Clubhouse.
You can see the rooms are all set up really nice. There's a crib for Aiden. There's washer and dryer facilities for all the families to use. It's all the comforts of home, away from home, obviously.
I didn't expect this at all.
Am I afraid? I'm not going to sit here and lie. I try to be strong because I don't know the unknown. So I fear that.
They were just 2 weeks away from an important anniversary, 2 years cancer-free. But CJ got news that he and his mom, Cookie, never wanted to hear.
Hey, Mom.
How are you?
You gonna have a seat?
Yes, sir.
So, I know you had to put up with some news after a couple of years. At least we know what the deal is and we can help take care of it.
His cancer is back.
We see a spot that lights up now on the MRI that kind of counts for your symptoms and what we see on your eye. Does the light bother you? Follow the light for me. Look up here. Again. You got any double vision looking up?
Yeah.
Okay.
What looks like a black eye from a fight is actually the result of a tumor that's behind CJ's left eye.
2 weeks left to his 2-year remission. That's why I'm stressed.
Control what you can.
Always.
Here we go again, but I mean, it's all in God's hands, really, so I can't do nothing about that. I just gotta go along with it.
And I know he's stronger this time. And we got through it the first time together, with his sisters, myself, and the help of my mother.
The whole family partnered with the Joe D team last time, and now they must do it all over again.
I've had other experiences, other places, and no, I just love this hospital, and I know everything's going to get done. So,
I mean, he's got to get better with family, not only treatment.
There is little time to get used to the idea of his relapse. CJ is taken down to the radiation lab to have a mask molded to his face as part of his new radiation regimen.
all right, give me a kiss. I love you.
You can come into if you like.
In the room?
For a moment, Cookie's forgotten that she can go where her son does, in this family-centered environment. She then follows him into the treatment room.
Okay, here we go, warm and wet. We're selecting the area we want to scan for the treatment plan. And we go a little bit higher and a little bit lower than we need, so we determine where the radiation goes.
Okay.
Cookie will be in on everything, which is critical this day. Radiation to kill the tumor needs to start immediately.
Will the neurologist be passing by tomorrow where we could ask him any questions before the procedure?
Yes. Being here alone and nurses walking in and out, it's just not me. I like being with my mom.
Hey, boy.
Everyone sat quietly. Scamper stopped his tail thumping. I'm just glad I'm here.
We were playing tag and I tripped over my foot trying to get away from my friend. And I put my arm behind me to try to stop it and it broke.
In Joe D terminology, Cheyenne Cruz is a frequent flyer. Born with an immune disorder, she's in the hospital a lot. And her parents, Joan and Diego, take full advantage of this family-centered environment.
Because a lot of it, for kids, it's scary. They don't know what they're dealing with, they don't know what they're gonna go through, and just to be there and seems to calm her down, and that helps a great deal.
I like having them here because then they can take care of me.
You okay?
Yeah.
This time, a broken arm has landed Cheyenne in a Joe D emergency room, and being there for her folks won't be easy.
So the bones come like this, and then you push this down, and they should realign. They should come like that.
You see, resetting a bone is unsettling at best for medical professionals, let alone parents.
I really bent her arm really far back. It looks really bad. If you guys are okay with that, that's fine, but it looks bad. I'm just letting you know. Okay. If you can wait outside, you can stay in here, whatever you want. To me, it makes no difference.
Okay.
But Joan and Diego decide to stick it out. After sedating Cheyenne, Mom and Dad watch as Dr. Dominguez uses leverage to pop the bone back in place.
I couldn't look, but but at least it's over, and now we'll just get the cast and we'll be able to go home.
If I hadn't seen it, it would still be better, everything would be great, but I'm just glad to be here and just witness it. Sure.
Yeah, you can put a thing on. You know what to do, Mommy.
Yes, please.
Another x-ray, once again with Mom choosing to stay in the room in a protective apron, proves that resetting the bone was successful.
You see here, it's together. See, both pieces are together now.
A cast and rest are now in order for Cheyenne.
I'm gonna send her home with some pain med.
All right.
Just in case. Sure. When she wakes up, she gets to go.
Okay. Outstanding.
All right.
Thank you very, very much.
No problem, guys.
Okay.
Good.
Cool.
Okay, hurry up.
Next on Joe D.
DiMaggio, this is Rescue 45. We're en route to your facility with a 2-year-old black male child. The child was backed over by a vehicle.
A father's anguish as he's bedside in a Joe D trauma room.